Okay, this is a continuation from my original video when I was doing the Supermans or the leg lifts, and I was at the very end and it just cut off because I'm not with technology these days. I'm just using my phone, and for some reason it just decided to cut off. It was pretty much right at the end anyway, and I was talking about if you feel even the slightest twinge in your lower back as you're on the ball like that, just maybe give it a try by drawing your abdominals in more, pushing your pelvis into the ball more. If you feel any cervical pain, drop your shoulder blades more, tuck your chin more. Those are just some cues that'll help you. So those two exercises are very, very good and will help prevent low back pain. May help alleviate some back pain if done correctly. Okay, next one I'm going to show you is pelvic tilts on the ball. Okay, this is a very amateur video, the best there is, right? Okay, so let me just go this way for a minute, just to show you. You can catch the ball a little bit because of the way I have it. All right, here's the ball. You can see where my hip is and my knee is. Okay, you see this straight line? This is how you should look when you're sitting on your ball. So when purchasing a ball, there's different size balls, and you can use different ones for different reasons. Like the one we just did on the other video where you're laying on it. Different sizes may be used for different reasons. But whenever you're sitting on the ball, this is very important. Actually, before I made the video and before I started my workout, when I was about to do this exercise, I sat on this ball and my knees were way above my hips. My hips were way down here, and I was on an angle like this because my ball needed air. So I had to put air in it just to fill it up so I can be right again. My ball, for me, is a 55 size ball. So, you know, they have 55, they have 65, they have 75. It depends on your height. So before you worry about, well, how do I know? You know, give it a test. You know, if you're at a gym, or, you know, if you, I'm 5'5", and I'm using a 55. So this is where you want to be. You don't want your knees to be above your hips or your hips to be above your knees. So if you're sitting on a ball that's way too big for you, you're sitting and everything will be tilted this way, okay, upwards. If you're sitting on a ball that's way too small for you, then you're going to be in this position. And also check the air, okay? So if you know that you have the right size ball, but you're not in this position, you know, you probably just are a little deflated. Not you, the ball, sorry. Okay, so pelvic tilts. There's so many cues and there's so many things to think about when even doing something as simple as a pelvic tilt on a ball. First of all, you don't want to sit with your legs wide open. You don't want to sit with your legs really close. You want your feet to be in line with your knees and your knees to be in line with your hips. So always think of this nice square table like this. Okay, so everything's straight. Even though we're not doing anything in a standing position like squatting or anything, you want to get into the habit of always keeping your feet parallel and straight. Okay, second toe pointing forward and just straight. You don't want one foot to be off, just slightly externally rotated. Just keep them both nice and straight. Okay, from here, bring your shoulders, roll them back, push them down into your back pocket. Tuck your chin, lengthen your cervical spine. Okay, zip up the center. Okay, I like to tell my clients sometimes, pretend that your skin here is a jacket and there's a zipper in the middle, and you're taking it, pulling it together, and you're zipping it up just like this. All right, so this is making you nice and tall. Okay, sit nice and tall. Don't ever sit like this, ever. If anything, you want to stay nice and tall. If anything, extend your spine slightly, just so slightly. That is better for your health of your back. Okay, we have so much of this because of driving in a car or sitting at the desk. or just, sitting on your couch, even when you're relaxed. It's just, see how I'm sitting right now? This is terrible. I'm not even over exaggerating, but I am so uncomfortable sitting like this because I am so used to proper posture that I can feel that my scapula is just forward, and I can feel I feel sluggish already. I have to be like this. Everything is about scapular stability, okay? Stabilize your scapula and keep your cervical spine straight. Stick your chest out, okay? Sometimes if you even over-exaggerate it. Now, I know us girls who were taught when we were little, don't stick your chest out. Yes, stick your chest out, okay? We're so accustomed to poor form and poor posture that even when you exaggerate it, within seconds, up to a minute, you're going to forget about it. So when you do, you might start to come back a little bit, and you'll actually come back to normal, okay, which is a good thing, rather than not having anything and just being like this, okay? That's going to actually increase low back pain or cause it. So, zip up the middle, nice and tall. Everything should just be like this, and like this. Very symmetrical, okay? I do have a nickname. It's called Posture Policewoman, okay? From here, again, inhale and distend your abdominals. Exhale, draw them in and grab onto them, okay? From here, put a little tension on your butt cheeks. Don't over-exaggerate, just some tension. Make sure that your lumbar spine is neutral, meaning that you're not completely in an anterior pelvic tilt or overly in a posterior pelvic tilt, okay? So, in a way to get neutral, if you're just not accustomed to being neutral and you find a hard time getting there, actually go into this arching of the low back on purpose, then just come halfway and stop. This is neutral. Okay, so you want to stay neutral, okay, and you always want to come back to neutral when doing this move, the exercise that we're going to do. Okay, you can start by just putting your fingertips on the wall or your hands if you're really unsteady. Okay, make sure that everything is in check. Okay, the whole kinetic chain is in check. You know, you've got all your check marks down the row. Okay, and from here, all you're going to do is tilt your tailbone under as you tilt your pelvis forward. Contract your core. Squeeze your glutes, and then come back to neutral. I'm going to do a few more and I'll explain it. Okay, so as I go forward, there's not a lot of motion in the ball, so I'm not going like this. I'm not trying to roll the ball. The idea is to keep stability in your pelvis. Just like I want you to have scapular stability, I want you to have pelvic stability. Tilt. Hold this position for about 2 seconds as you contract your core and really squeeze your butt cheeks together. Okay, and really squeeze it. Okay, like you're trying to inhale the ball at your butt. Yeah, I said it. Okay? And then when you come back to neutral. Okay, so watch one more time. Exhale. Inhale. Exhale. Inhale. Now, when you get used to it, you can take your arms away from the ball and challenge your stability even more. Just like that. Or just hovering, you have to hold your arms out like that and cause tension up there. Okay, you just take your fingers and just hover them outside the ball. And of course, you get unsteady, you can just grab onto the ball. Okay, so that's the forward pelvic tilt. Okay, next is just going to be a sideways, side to side, rocking your hips side to side. And we're just going to shift our hips like this, boom, like that. The same idea, we're going to keep pelvic stability, we're going to try to keep everything centered here as we're doing this. And we're going to try to keep as least movement of the ball as possible, and everything else is in check. I don't want to have to keep repeating it, because by now it's probably implanted in your head. So, again, everything's in check, and now I'm just going to tilt, and I'm going to come back to neutral before I tilt back this way. It's a very small motion. Back to neutral. It's not an exaggerated motion. Okay, so you're not going like this, rocking back and forth. Okay, you have to keep control. Your legs are going to want to come to play, and you've got to stabilize them. So again, you don't want to do this and have your legs doing too much of getting involved, of going in and out. Try to keep them straight. Try to keep them from moving. You might see the slight motion. As long as you have, I mean, it's so slight. That's because you're stabilizing them to stay straight. Okay. So the scapula is stabilized. I'm looking straight ahead. My belly button is engaged. I am rocking using my butt, using my core, moving my hips, very controlled. Once you get to a rhythm, you'll start feeling a little bit in your obliques, you feel a little bit in your butt cheeks, and you're all good there. Okay, so there is a third one, okay, and this would be for people who have mastered those two, and it's just rocking around the world, okay? The same idea, all right? You're just rolling your hips, and again, when you get to the back part of the roll, like here, don't overarch your back. Try to stay as neutral as you can. You don't want to over tuck, and you don't want to overarch. Okay, and again, keep the movement only in the hips. Just in the hips, not your whole body. We're not doing this. We're not at the club. Okay? So if you have music on and you find yourself getting too into it, turn your music off and concentrate on what you're supposed to be feeling, which is your hips and this is where mind and muscle connection comes into play. You have to focus on what you're supposed to be feeling. When you're done doing your reps, 10 to 20 is fine. Reset, reverse it. Go back to neutral and reset before you reverse it. Okay? This is Bernadette with Personal Training with Bernadette. Thank you so much for taking time to watch my video. It's not high tech like some videos, and this is just a little corner in my room here, and I'm doing the best that I can, but I just want to share what I know with you guys to try to help as many people as I can, because I am a health and fitness professional. Fitness is my life, but helping others is my passion. Okay, take care.